my name is Sanchez,
And I'm Patricia, Capiral.
and the purpose of this project is to help bring awareness to DMD or Duchenne Muscular Dystrophy. The story that we wanted to tell specifically in this project is that every single case of DMD is very distinct and different in its own ways. So, what we're going to be showing you is two different interviews with two different families that have very different experiences with DMD. So, the first interview that we did was with the mother who has a 4-year-old son that's affected by DMD. Another interview that we did is with a mother who has two sons affected by DMD, but one of who is 19 years old and the other is 16.
So in class, we learn of DMD as something that's kind of structured, but with these two stories, we hope to show that each individual affected in each case is very unique and different and, plays a big role in not only the patient's lives, but the family members' lives as well.
Can you introduce yourself and tell us about your son with DMD?
Sure. So my name is Ashley, and my son, his name is Gian. He's 4 years old, and he was diagnosed with Duchenne about a year and a half ago in April of 2016.
My name is Patricia Beckham. I have two sons with Duchenne. One is named Christopher, he's 19, and the other one is named Blake, and he is 16.
Okay, when did you first find out that your sons have DMD, and how did you feel receiving this diagnosis not once but twice?
I found out when Christopher was 2 weeks old because we had a family history of it, and so he was not a planned pregnancy. So we found out when he was 6 weeks old because we knew that if I had a child, the chances were 50-50 that he would have it. And then Blake, we actually just watched him, and it looked like he did not have any of the same symptoms as Christo. So the test is really expensive. I think it's like an $8,500 test. So instead of spending that money again, we just kind of were like, he's not exhibiting the same symptoms. He's totally different. He wasn't doing gowers. He walked earlier. He was crawling when my older son didn't. So we didn't get him tested. And so I think Blake was probably 4 years old, and we just said, hey, will you pull a CK level on him? And it came back 20,000. And so that, that if it's 20,000, they've got Duchenne.
It's, as you can imagine, kind of knowing what Duchenne is now, it was devastating. We had never had any family instances of Duchenne before, so this was the first presentation of Duchenne in my family.
So how has their medical history been throughout the years since they are older already?
We have a really mild case. So, for example, they both can still stand up. They both still walk a little bit. They use scooters. They aren't in wheelchairs. And they don't have any heart issues. Their hearts look like a normal person. Their lung function is 100% normal. So we're not seeing a lot of things that other people are at age 16. I mean, there's boys that have passed away at 16. There's boys that have passed away at 10. So ours is just a little less severe, but we're also very proactive with therapies and just making sure we're doing everything possible.
And where is their mutation, if you don't mind me asking?
Not at all. Their mutation's 5, 6, 7, and that's a duplication. So really rare. I think it's only 7% of boys with Duchenne have a duplication, and the fact that the duplication is on the beginning of the gene makes it less severe.
Did Gian face any challenges as he was growing up, like developmentally, physically, and can you share some of his experiences with us?
Yeah, absolutely. He was diagnosed about a year and a half ago, but we started noticing or started having concerns, I guess, probably from when, even now looking back, when he was really little, like when he was an infant, he wasn't really able to hold his head up on his own, like when we were doing tea time. And then when he was about 12 months old, like when other babies are usually walking by that time, he wasn't walking and he wasn't pulling himself up on furniture or anything. So 15 months came, still was not walking. He was like army crawling across the floor, so just kind of with his forearms like pulling himself across the floor. So we brought it up to her again. She said, well, let's just get him going in some physical therapy and we'll see how he responds. And the physical therapy, it took him a full year of physical therapy from the time he started when he was 15 months old to when he was then able to walk on his own. So he didn't start walking until a few months after his second birthday. Took a break for about 5 months, but we noticed in that span of time, like his abilities were regressing. So he was having a harder time walking and kind of doing like this marching thing that was new. That's when we finally got him a referral to see a neurologist. And the first thing that we got back from neurology, they did a MRI of his brain and his spine just to see if there was anything they could find on there, and then they did a basic metabolic panel too, and that's where the elevated CK came back, which kind of clued us into that with his physical clinical symptoms. We were then referred to neuromuscular because they were pretty positive it was Duchenne, just given his age and his abilities and his CK. So
yeah, they're both really smart. Yeah, they don't have any developmental delays at all. The Flazicort does cause a puberty delay, but we combat that with testosterone. But in terms of school, they've always just been really good students, done well, normal classes. So yeah, no differences in a normal kid their age.
Did you ever have to explain DMD to your son? And if so, how did you go about it?
Sure. Not yet. Not at his age right now, since he's 4. He doesn't really understand exactly what's happening. Even though he's 4, more cognitively, he presents like maybe a 3-year-old, 2.5, 3-year-old would. So his comprehension isn't quite there yet. And I think as he gets older and we're able to kind of explain it in terms that he would understand for sure, we'll let him know. He knows that he has special muscles, and like he'll say to me sometimes, "Like, my legs really hurt today." So I think he understands that part. But it's also, I think, more of the frustration piece right now. Like he doesn't understand why he can't keep up with his peers, with his classmates in preschool, or his sister who's 3. She's already running around and things like that. So it's kind of, I think he understands that he's different. He just doesn't know exactly why yet.
And it's really a progressive discussion. So when they're 5, you start out by saying, your muscles are different than everybody else's. That's why you get tired. That's it. Then they get to be 7 and they're like, I can't run as fast as Bobby and I can't climb stairs. Well, yeah, because your muscles, they break down more easily when they don't rebuild. So you just give them a little bit more, and that's kind of how I approach that. Is at every stage, I did try to let them direct it. I would wait for them to say, how come this is happening? Or I noticed today this is happening. And so that just gave me the opportunity to say, okay, I'm going to give them age appropriate information rather than just saying, oh, you're fine. Other thing that we did is we would have the boys stay home one day during the year. Usually at the beginning of the year, we would go into their class. He would go in and he would give a presentation. This is what Duchenne is. This is what it entails. And every year it was different. Because in kindergarten, it was a much different presentation than in 4th grade or 5th grade.
Do you have any special accommodations in place around the house to make things a little bit easier for him?
Right now, we don't really. We just bought a house last year, and it's like a 2-story house, so it's not ideal for Duchenne. Right now, what we try to do is we try to monitor his stair usage, so I don't really let him go up and down the stairs much at all. I carry him up and down typically, or he'll sit down and kind of go down on his butt.
Have you met other families with children with DMD? And if so, how has it been being part of that community?
Sure. Yeah, we've connected a lot. We've connected with a few, probably like 3 or 4 or 5 actually, local families that are probably within like 20 miles of each other in Minnesota, which is pretty nice. We've gotten together, like when it was World Duchenne Awareness Day, we got together for that day and got our kids together, and it was kind of nice for them to be around kids that had the same abilities. They weren't none of them could really run or, go fast. So it's kind of, and I think they kind of all understood each other's abilities. So it was kind of nice for them to be able to play with each other. But beyond that, we've connected with a lot of like Facebook groups dedicated to Duchenne. And that's been really nice. It's kind of nice to be able to like bounce ideas off of each other. Like I had a question before we started being on steroids. He was having a really bad reaction when we tried the prednisone. So we were taking him off that, but then because he's not 5 and the whole issue with getting him on the Emflaza here, what do we do in between this time? Because he can't get on that medication until he turns 5. So, so it's just really nice to have that community support there. And because a lot of the times we've seen a lot of the same doctors too, and we, any question that one of us may have, we can get a pretty good answer.
We've met dozens and dozens of families. This is what I would say. Our community is kind of like a little Hunger Games, and it's really weird. Because what you have is you have therapies coming out that help a percentage of the community. And so then those people get really excited and they want more money to go towards their particular cure. And those of us that may not benefit from that cure are kind of left here standing there like, that's super great for you, but what about everybody else? The one thing I will say is when you see the sheer number of people that are interested in Duchenne, that's very encouraging because 20 years ago, people are like, what? What's it called? Nowadays, when you say it, people go, oh, I've heard of that. Yeah, that is something that I've experienced or I've heard of, or I know somebody, or this person has it, or that person has it.
Is there any way, or do you have any methods in trying to normalize everyday life for your son?
Yeah, I think we do. We try to have him live as normal of a life as possible. So we try not to focus on his disability a lot. It's just he is who he is. He's John, and Duchenne doesn't define him. It's just it's a very small part of who he is. So if we can move past that part and just focus on like who he is as a person, and I think that goes for any disability, anybody that is affected by a disability. We can just move past what the disability is and just focus on who they are as a person. That would be great because he doesn't have to be defined by his limitations.
So with a disease like this, we understand that family is a huge part of his support group. So how has this journey been for you?
It's been challenging, and then in the challenges there have been some positive things come of it too. So since getting Gian's diagnosis, we found out that I am a carrier, and that was something that I struggled with for a while. Like after learning that I was a carrier, and then Gian had Duchenne, it was like, wow, I had no idea, and I just kind of have that mother's guilt. I think like this feeling horrible that you pass this on to your child without knowing. But I wouldn't change Gian for the world. He is who he is, and Duchenne or not, he's still my son and we still love him. But it's kind of had implications for our whole family. So we had a daughter tested, then it turns out she's not a carrier either, thank goodness, so we don't have to worry about that. Family support and the support of others in this community too have really been what kind of helps when we're maybe in like a darker time, like, oh, Gian's having a really hard time walking today, he's not feeling well. It's kind of like nice to be able to express those feelings to other people who just get it and understand what you're going through without having to really explain.
It's a roller coaster ride, and the people think of grief as, it's a 5 stages of grief, and sometimes you're in stage 1, and sometimes you're in stage 5, and then sometimes you camp out in stage 3 for months. There's things that happen that are exciting. My younger son, we just bought him a handicap accessible car. That's getting here tomorrow. He's super excited about it. So we're like, oh my gosh, it's so exciting. But the car gets here. We're going to try to outfit it with a couple of things. If that doesn't work, it's going to be devastating. So you're constantly kind of like, oh, this exciting thing's happening, but the reality is you're constantly saying to yourself, it's going to be okay. I have no idea how, but it's going to be okay. But I think what I try to do is be optimistic for my kids, but at the same time, not hide the fact that this is hard. It's difficult for them because sometimes they feel bad. They feel bad for having Duchenne. They feel like, they're a burden, right? And so you're constantly saying, "Are you kidding? You're the greatest thing that's ever happened in my life. How could you say that?" But sometimes when you express, "Right now, I'm just tired. I'm overwhelmed. I'm so sorry." And to them, they may not hear that. They may just say, "This sucks because I have Duchenne. My mom's feeling this way." And that's not the case, right? We all make choices and decisions, but you're in this constant state of overwhelm. And I don't think you can ever get to a place where you don't feel completely and utterly overwhelmed. And that's just how it is. And you learn how to kind of find normalcy in that and figure out, okay, every second can't be about Duchenne, right? It just can't. So we try to really not make it about that every second of every day, because sooner or later you just have to shut up, right? You just have to shut up and stop talking about it. It is what it is. What can we do today to just be normal people?
What is your opinion about the current state of DMD treatment options?
Sure. Well, it's really a hopeful time. I mean, obviously, I kind of wish things would move faster than they are right now, just because we just never know exactly how long we have with our kids. So it things like gene therapy seem to be very promising. I know those are showing a lot of positive results in these very early clinical trial stages, so that's really awesome. I hope the CRISPR technology can kind of move along a little bit quicker, because I think that will even be superior to gene therapy. But we have Gian, he's on a wait list right now to get in at Nationwide for some gene therapy, so we'll see what happens there. I know the list is pretty long though, because they're in these clinical trials, so we'll see. But it is really a very hopeful time. We're very involved with the Muscular Dystrophy Association in Minnesota, and just they kind of keep us updated on how progress is going, and we do a lot of fundraisers with them, and I know they're really focusing, like they're giving a lot to research right now, as is Parent Project Muscular Dystrophy, and we're all kind of focused on the same goal. That's to really increase this funding to get better treatments and hopefully to reach that cure anytime.
But I think our biggest hope for my boys is a therapy, and our standards have changed, right? We wanted a magic pill, and now I'm like, just help them so their muscles don't hurt, help them so they don't have to go in a wheelchair, help them so they can use their arms, right? My younger son's losing a lot of strength in his arms, and you look at those things and you're like, this can't happen. How can we stop that? Who cares about curing it, right? How can you help them maintain strength in their arms? So it just gets to be, okay, well, we'll kind of change what we're looking for now. Now we'll just take this, and you start to get more and more desperate. And you're like, I'll take anything, right? But at the same time, you want to make good choices and that sort of thing.
So if you had like the opportunity to share what DMD is to you, and like what other people who don't really know about it should know about it, like what would you say to them?
Well, I think just if you ever have any questions about your child's development, like really push for answers, because I feel like we didn't do that, and I feel like we could have probably saved ourselves like a year or more of not knowing and knowing that something was wrong. It is a life-changing thing, but again, the more awareness we can raise and do anything positive out of this kind of crappy situation, then we'll do it.
So we hope you enjoyed and learned a lot from these two interviews. We really appreciate Ashley and Trisha for sharing their family's personal experiences with DMD. The story that we really wanted to highlight through this project is that every patient's experience with the disease is very unique. Although the three boys that we learned about in these interviews all shared the same diagnosis, their story and personal experiences with the disease were very different. For example, Blake and Christopher, who are in their older teenage years, still have ambulation, while Gian will most likely become wheelchair bound within the next few years. Christopher and Blake's stories also really highlighted the necessity for individualized therapies for DMD. As Tricia talked about, her boys wouldn't be able to participate in clinical trials as her sons are much older and don't fit the ideal age group affected by DMD.
In class, we learned about the typical symptoms and criteria of DMD boys, but didn't really hear much about boys with DMD still having a decent amount of muscle function by the age of 16, yet alone 19. I think this message is very applicable to any disease since every single story and experience with a disease is different despite being labeled as one specific thing. We learned a new perspective about the diversity of DMD and the ways that current treatment methods are lacking for non-traditional patients. And as we learned in class, some mutations in the dystrophin gene are either less or more severe in the way that they present themselves. But we need to ensure that the treatment methods and approaches are geared towards every single patient and not just the majority, which is why we believe that individualized therapies, including gene therapy, will be very helpful tools for the future of DMD treatment.
We would like to thank Tricia, Ashley, her family, and all the faculty and TAs for PS 121. It's been a real pleasure learning about diseases on a more personal level as opposed to just in the typical classroom setting, and which is a great experience, especially for pre-med students. So we just want to say thank you.